Give it another 30 seconds. All right, I'm going to get us started because I know that both the talk is going to be terrific and there will be lots of discussion. Welcome to our February seminar from the Brown Lifespan Center for Digital Health. For those who have not joined before, the Brown Lifespan Center for Digital Health is a joint center between Brown and Lifespan dedicated to the creation, evaluation, and dissemination of digital health tools that make a difference for patients and populations. I'm Megan Ranney. I am the director. Allison Seeley, who is our education coordinator, is also on. We send out notices about these through our listserv. So if you're interested in getting on it and you found out about this talk through some way other than our listserv, feel free to message Allison in the chat and we'll make sure we get you added in. So I'm totally thrilled today to introduce Shuhan He, physician, researcher, and friend, who's going to talk today about emojis for the medical community. Shu is a dual faculty member in the Department of Emergency Medicine and Lab of Computer Science at Mass General Hospital. He's director for digital growth strategy at the MGH Center for Innovation in Digital Healthcare and is an instructor of medicine at Harvard Medical School. He was the author of the anatomic heart and lung emoji that are available now on mobile devices worldwide, and was the senior author of a JAM article entitled Emojis for the Medical Community, which provides more, or actually shorter detail on the stuff that he'll be talking about today. He also was the co-founder along with me of Get Us PPE 2 years ago, which is how he and I first got to know each other, and is just a brilliant, innovative, and kind person dedicated to making the world better for patients and for healthcare providers. And I'm so excited to welcome him to give this talk today. Basically, for those who have not attended before, we'll have Shu talk for somewhere around 30 or 40 minutes, and then we'll open it up for discussion and answer. Feel free to put comments in the chat as we go along. Allison and I will moderate questions at the end. Shu, take it away. Thank you for joining us.
Absolutely. Thank you for the introduction. Thank you for having me, everybody. So I'll dive right in. This is basically emoji for the medical community. We have really 3 parts to this talk, and I'm going to spend most of my time on parts 1 and 2, which is just the emoji, right? The process, how it works, and what we're trying to do with having more representation of medicine in the emoji keyboard. I'm going to talk a little bit about patient-reported outcomes, which I think is basically the next phase of what we're trying to do of using the emoji once we get them. And then the third is a little bit of theoretical basis of having emoji and why this is really applicable to emergency medicine and medicine in general of these very persistent problems in medicine and communication. I'm going to spend a little bit of time on that, but most of our time is going to be focused on 1 and 2. So just diving right in. Emoji are basically a problem that arose from something in the 70s and 90s. So in the 70s and 90s, you had the basic modern computing, and a lot of companies were creating their own proprietary systems to communicate. So you had Apple that would have their own system, and IBM and Sun Microsystems. But the issue was that they could not actually talk to each other. So if you were Apple, you would talk to Apple devices, but there was no common language and agreement for Apple to talk to IBM devices. And this is actually a really big problem, right? So what happened was that a bunch of these technology companies got together and they created something called the Unicode Consortium. And it really has today 3 key goals. And I'll talk a little bit about how the evolution of this happened. The first is just language. So when you type in English language on your keyboard, this is basically underlying that the code is something called Unicode, which allows you to translate English from one device to another. It also does all of the other languages like German and Latin, but also characters. And I include in that Chinese and Arabic, because those are pictographic languages and they need basically a visualization of that language into the device. And this is where emoji actually is in that category as well. And then third, last, obviously probably the most important of all this is that they have one unifying code that underlies all of this, so that every device in the basically the world they can use Unicode, can reference the code, and can understand when devices send a piece of Chinese from one device to another, that you're not getting an error signal and you're understanding this code. Who sits on this consortium is actually very interesting. It is basically majority large technology companies. So Apple, Facebook, Google, kind of very classic companies. In the last few years, it has also started to include even things like governments. So governmental representation like India, and then smaller nonprofits like Emojipedia. And so that's kind of where I started to come in as well, and the organization we came in. So a little bit of timeline here. So Unicode was formed in 1991. The first Unicode proposal was actually for emoji was actually in 2000. Somebody proposed it, and Unicode said, "This is not within our scope. Why are we doing this?" But actually, in 2007 was actually when they started to uptake emoji into Unicode, because a lot of these large tech companies wanted to go into Japan, and emoji were very, very popular in Japan. And so they decided that, yes, we needed the common coded language to for American devices talk to Japanese devices. And so they included this into part of their basic committees to consider emoji as a universal language within Unicode. In 2017, by luck, a brain emoji was proposed and accepted into Unicode. To be clear, I had absolutely nothing to do with this whatsoever. But it was very lucky, because that meant that this opened up a category of emoji for medical purposes. And so in 2019, I worked with an organization called Emoji Nation that works to help to get more representative emoji into the Unicode code for the heart and lung emoji. And in 2021, we talked about the JAMA article, and that's a lot about what we're going to talk about today. To give a sense of this, so in 2019, this was approved. This is what the original drawings looked like. We were actually not advocating for the implementation of the code. We were actually just fighting for the inclusion of a assignment of a number, or the code that would allow all the other devices, Twitter, Facebook, Google, Android, Apple, to then interpret that piece of code that would say, okay, this is a lung, this is a heart. And then it takes about a year and a half or so to roll out onto their devices. I'm going to actually give a 2-minute trailer of a movie here. This is called The Emoji Story, and it's actually a really amazing movie. I would recommend everyone to watch it. And I want to emphasize here that this is a long battle that we have been undertaking for all of these emoji. And I want to point to what happened with the hijab emoji and how long of an advocacy fight this was. And so I'm going to play this 2-minute video. I think it will explain so much more of what of the background and the decades-long fight, essentially, for representation here. So let me play this.
To be able to send an emoji that looks...
Can everyone see this? Is this okay?
Good. Like me. I say, oh, really? What is an emoji?
For communication with friends, it's a huge part, to the point that it's kind of scary.
I dot the bottom of my emails with palm trees sometimes, just to liven the mood.
I like the poop one.
If people communicate through emoji, what is on the emoji keyboard therefore kind of defines their world.
Anyone can submit an emoji proposal. Where do you draw the line?
We are campaigning for a period emoji.
The Unicode Consortium, there is an actual organization that I could contact.
If it's really a new emerging language, it shouldn't be controlled by some committee in San Jose, California.
A bunch of old white guys, basically.
I'm stepping in a pile of poo emoji here. There are trillions of these sent by way of text messaging all over the world, and they were all Caucasian.
If there are 4 emojis to represent the mailbox, why on earth isn't there one to represent the 500 million Muslims that wear the headscarf?
Nos falta encontrar cosas de nuestra cultura, y me parecía que teníamos que ir por el mate.
Good luck, we'll let you know.
Que le den oportunidad a otros emojis que sean más sentir popular.
It's a way of being engaged emotionally in a positive way.
Getting a global emoji could go some way to saying, it's okay, I can talk about this. This isn't the most embarrassing thing in the world.
This is a huge opportunity to represent everybody.
Whenever you have the chance for diversity, you should definitely take it, because at the end of the day, it will only promote tolerance and acceptance. Good. Thank you!
So I think that hopefully gives a little bit more context to this very, very difficult fight to basically create more emoji into the Unicode consortium. And so let me share my screen back again. Okay. Am I back onto screen sharing? So basically, we are doing the same thing in medicine. And I think that's really fundamentally important. I'll talk about why when it comes to basically the candidates that we have today. We have existing emoji in the Unicode keyboard. If you open your phone, you can see that there's a doctor emoji. And actually having a male and female was actually a really important step, for example, for representation of the idea that physicians should not just be men, right? You had accessibility emoji, and these were actually pushed by Apple when they had a big accessibility push for their devices. And obviously the heart and lung was something that we pushed for from our group. And then we have basically a limited set of things like teeth, bone, and a pill. What we're proposing is that there should be a more unified set of emoji, especially representing the anatomical organs that exist, and a few extra that I think are fundamentally really important for medicine. The first is basically this idea and category that if you have a brain, you have a heart, and you have a lung, you should probably have a stomach, kidney, spine, intestine, and liver as well. Also, emoji around EKG, and which is a really important just representation of what we do in medicine, right? And then one thing I find really funny is that, especially in the global pandemic, when we have a virus, a bacterium emoji, we do not have a white blood cell emoji. So something that is really important that we are fighting for today. So what exactly are we fighting for? We'll talk about what we're doing here. So when you think about emoji, when you look at the Chinese character for heart, it actually looks like a heart and actually is a really great representation of it. They have a Unicode, something called the code point, and this is U plus 5FC3. And the anatomical heart is very similar. It's U plus 1FAC0. And so when we look at and we're advocating for the emoji for the intestine, we are looking for basically that new U assignment for the intestine. And to compare, the Chinese character for intestine is U plus 80A0. So we are doing the same thing for spine and stomach. And so there are a lot of considerations when we think that Unicode takes into account for these emoji. So inclusion, I'm not going to go through every single one of these, but for inclusion, it needs to be really important that it's distinctive and it has multiple usages. And then there's exclusion criteria. So things like, oh, it's not a logo of a company, or there's no, copyright trademarks around some sort of logo, as an example. So I'll give an example of the stomach. Are there multiple usages of the stomach? Well, I would argue, yes, there are, because it can represent things like feeling of hunger or fullness beyond just anatomical usage. It also has many uses in cuisines like menudo and tripe and pho. And also it is very colloquially used very frequently, such as laying down on your stomach. And so it can also be used in a sequence. So stomach and food can represent eating, or stomach and a clock means time to eat, or stomach and angry is a stomach ache. So, and also what's really important here is that it does not break new ground, because we have the brain, lung, and heart. And so that is already an existing category. And I would argue it is very distinctive. And actually, this is an interesting point. We actually had previously submitted the stomach emoji in 2020 after the success of the lung and heart, and it got rejected mostly because of this category. If it was felt that the distinctiveness of the stomach was not universal. And I think for this audience, especially in medicine, it probably was very obvious. But for a lot of others, it may not be. And so this really creates a conundrum of, if you do not have the stomach emoji, do people know what the stomach means and what it looks like, right? And this is when it starts to become part of this question of, is this really fundamental to understanding of medicine and health? And I would argue, yes, it is. So statistics, it is used. I mean, I don't think this there are billions of emoji used every single day. 92% of the population uses emojis every single day. And what's really important here is that it's actually processed in the brain as nonverbal communication. And it is a more emotional communication. It is not processed like just pure text. It actually adds context to communication. Like when I say a word, I'm also speaking with either a smiley face or anger or irritation, or whatever that context is. Emoji adds that kind of processing to that verbal language that when you send those emoji. So to be clear, acceptance of Unicode is just the first step, and this is what we're fighting for today. When we get these emoji accepted, we would then have to go through a long process for every company, especially the major ones, to interpret it properly. So I'll give you a story about this. In 2019, when we got the anatomical heart emoji, this was a very small group, and this was basically just me representing medicine entirely, and which is really scary because when you're speaking to one of these companies and you're trying to get the anatomy right, it really feels like you could possibly get it wrong. And so me pulling up my netters, I really wanted to make sure that I had the anatomy right, because the first iterations for one of these companies actually had an anatomical defect. And actually, it's really funny. The other thing is that most modern EMRs are moving to Unicode because as their reference for text as well. And so that means that these emoji are then already in a lot of modern electronic medical records. And to be clear, implementation has to be done right, because when it's done wrong, it actually becomes an international scandal. So in 2017, the Google actually put the cheese underneath the meat. And this became a huge scandal because people were very angry that you cannot put the cheese underneath the meat. You have to put it over the meat. And it became a representation about how Google did not understand people and Apple was so much more user-friendly. And literally Sundar Pichai had to tweet, this was his #1 priority to fix this emoji. And so you can imagine my nervousness when I was the sole representation of this anatomical heart. If I got it wrong, how many angry emails I would get from cardiologists who probably should have been part of this process to tell me, that we need to get the heart right. So that's why, it's so important that this becomes a collaborative process and not just one physician advocating for these emoji. To be clear, they also have a very significant cultural importance. So, as you saw in the trailer briefly, when the emoji, there were actually emoji that are displayed now in the Smithsonian Design Museum, and it's really important. And there's a lot of representation here. And I always think about basically if you're a child and you have a father, or you're a child yourself who is on the kidney transplant list or the liver transplant list. What does it mean that you do not have a kidney or liver on the emoji keyboard to represent you and your illness and who you are, right? That becomes a huge problem. And let me kind of give a sense of this. There today exists no kidney and liver emoji, but there are emoji for beer, clinking beer glasses, wine, sake, champagne glass, martini, a tropical drink emoji, milk, mate, drink, coconut drink, ice water, but there is not emoji to represent both, one, the alcohol that is in most of these drinks, and two, the fluids that are processed and the vital organ that processes these fluids. For the GI system, for intestines and stomach, I want to point this out. There is an entire category of food, ranging from donuts to every single carb and cookie and bread and meat available. There's even a poop emoji, but there is no stomach emoji. Okay, so I personally get really offended when I think about this, and this is why it really is driving a lot of the work right now to make sure we can get the stomach emoji represented to the keyboard. So we have something called the Emoji Organ Playbook, where we are working on currently getting these organs endorsed by formal societies that help to represent these emoji. And then we are working on, as kind of the next step, a priority letter from federal societies like the NIH to say that there should be a more unified set of emoji that should exist in the Unicode Consortium. Unicode Consortium is fundamentally a consensus setting organization, so they respond to society consensus. So when we are able to get basically the societies to come on board and say, there probably should be a liver or there probably should be a stomach emoji, Unicode does respond and respect that society opinion that these emoji are fundamentally really important as part of representation in Unicode. So that's why we have the medicalemoji.org website and the campaign that is occurring right now, and I encourage everyone here to join. And this is basically a campaign to get more letters from societies representing each one of these emoji. Basically, what we're trying to do is three key things. The first is endorsements, as I mentioned. Two, online engagement. So the use and the requests on Twitter are actually followed by Unicode. So you can actually, in the proposal, say this many users have requested a emoji, and that's actually will become part of the proposal. And the third part of this that we're trying to seek is a federal letter, mostly through working through these societies and their representatives in Congress to look for a federal letter to say there should be a more unified set of emoji. So progress has been sporadic, but very successful for a specific emoji. So for example, the kidney emoji has a very robust online Twitter, Nephro Twitter community. And they have been very, very excited to throw their endorsements and weight behind the kidney emoji. So almost every society that I've learned about these societies has come on board to the kidney emoji, including Renal Physicians Association, International Society for Nephrology, even smaller organizations that represent clinical trials in emoji have come on as well. For the liver, the American Society for Liver Diseases has put together a formal letter to endorse as well. And then the American Gastroenterological Association has actually put their weight and actually a lot of their work behind the intestine, the stomach, and the liver. What I would say is that I think there should be more. And I think it's actually really fundamentally obvious that if you are, for example, the American Surgical Society or any society that represents surgeons and manipulation of these internal organs, that this would be probably really fundamentally important to have this sort of to have these emoji into the emoji keyboard, and because it would be worldwide and it would be an international news sensation. So that's kind of the first part of what we're talking about. Any questions on that? Perfect. Okay. So the next part of what we're talking about is patient-reported outcomes. So this is a really interesting part of the emoji question of when we create emojis, what do we do with it, right? And so I'm going to just dive right in. So there's something called the Patient-Centered Outcomes Research Institute, or technically it's a trust fund, but basically it's something that was created by US Congress after the Affordable Care Act in 2010. Basically, it is a very, very large federal institute that disperses millions of dollars every year to ask this fundamental question of how do we ask patients how they feel, okay? Why? Well, because in 2010, when they created the Affordable Care Act, one of the biggest problems in medicine and persistent to this day has been that we pay for fee for service, right? As in you do more and you get paid more, which creates really perverse incentives to do more things. Instead, what they wanted to do was to say, why don't we compensate physicians and health systems by actually by making patients feel better and making them healthier? But then the fundamental question became, how do you measure it? What does it mean to be better? And so there was something called the patient-reported outcome that has been a large question and basically one of the really important part of integration into medical practice. To this day, when you go to the medical doctor or a doctor at the ER, you have tabs for lab results and you have tabs for x-rays. But the way that a patient feels is only subjectively entered as a note in the doctor's medical note, but does not enter the medical record as an objective finding that is a patient-reported outcome. And these patient-reported outcomes are very, very hard to measure because they require lots of data, right? And they require digitization of tools. So what we want to be able to do in medicine is to say, this patient feels a headache or pain or depression, and we want to make sure patients feel better, okay? So you have these measures to say, you can then say, oh, we did a knee procedure. This patient after the knee procedure felt better, their pain went down, and they were able to have a higher quality of life and to walk more and to see their children and to pick up their granddaughter. And that is really fundamentally what we're trying to do in medicine, right? Is to give people not only a new knee, but also have a knee that works and to give them better quality of life. So we have these things. We have spent millions of dollars trying to validate these kinds of scales. So as you come into the ER or any sort of hospital system, you will be asked, how was your pain? This is one of the most fundamental questions we ask. And actually at one point, and I think it's still considered one of the core vital signs, right? So there's something called the verbal rating scale. Tell me how your pain is. There's something also called the numeric rating scale. Tell me how your pain is on a scale of 0 to 10. And then there are something called visual analog scales. The most famous is the Wong-Baker scale that is seen in almost every pediatrician's office worldwide, okay? It turns out that this whole category of visual analog scales is a very active, robust area of research because that scale is actually trademarked and copyrighted. And so there are a lot of competing different visual analog scales, all with the same goal, which is to better categorize pain, depression, whatever the patient-reported subjective outcome might be, into a more objective way. And so why is it important that we have something like the emoji as a standard visual analog scale. So it turns out that, I'm probably not making friends with anyone Juan Baker here, but they actually charge a lot of money to use these things. If you want to use them in any sort of licensing, any sort of digital health application, you actually will pay thousands of dollars. The NIH actually has something called NIH Toolbox. Putting these into applications will cost you almost $5,000 a year, and just to put these kind of questionnaires into applications. So actually, one of the reasons why I actually knew about this problem was because I was developing an app for a hospital system, and we wanted to ask mothers how their confidence was in taking care of their child out of the ICU, and we couldn't do it because it was too expensive to put any sort of validated scale into any sort of digital health application. And so, as you can understand, that the Accountable Care Organization basically helped to push along these things called patient-reported outcomes, which is really tied to value and to better quality care. So basically, what we're trying to do is take a more fundamental approach to this question of patient-reported outcomes in an open source way. So the first thing we're doing is very simple. Just making it so that we can compare emojis to Juan Baker faces. Because to me, I don't know about you guys, but they look exactly the same to me. And I suspect that they will probably lead to the same outcomes. And actually in this talk, I'm gonna actually give a little proprietary data here. In our first first data trials, actually will show you that this is actually bearing out to be true. And I wanna point out that emoji are digital. What's so important about that is that means that you can do it every single day. You can push it to applications and phones, and then you can have very high quality fidelity data. And I give an example. This is actually my weight data. I have a digital scale at home. I've been measuring my digital weight for the last 7 years, and I can actually see trends in my weight over time, right? Why that's so important is that when you have data points like this, especially with subjective measures like pain, depression, they require mass amounts of data to really understand, find the signal from the noise. And so you're able to create trends because emoji are digital, whereas most of the visual analog scales that exist in Validity today that cost thousands of dollars are all on paper, and they are not able to become a part of a digital ecosystem to see the larger trend of how someone is feeling over time. So that's really really important to understand why this is an open source scale, number one, so it's free to implement to any sort of application, and also into electronic medical records, but also that it's digital natively. And so you can create and have this potential to better understand patients and how they feel. So that is what we're doing with our studies. And so we were asking, number one, are things equivalent, right? Are verbal scales and numerical scales and this visual analog scale, are they the same? And we will have lots of questions around this. So Unicode, turns out that there are multiple versions of it. And so, and then also, if you have an iOS Apple device versus an Android device, they will have slight variations in those emoji. So we have to make sure we do this right and interpret how patients feel in the right way. So this is what we're doing. We are doing emoji as standard visual analog scales. And kind of our next phase after that is asking patients, what is your pain like? Is it sharp, stabbing, dull, firing, right? Can you make these sort of panels that fundamentally can better help understand when someone comes in with chest pain or headache, what their pain is like? Because that actually is a way that we as doctors find a lot of information and about caring for a patient. If somebody comes in with something called a thunderclap headache, we use this word all the time. We almost immediately start to rush them to the CT scanner because we know this means a very potentially dangerous entity called subarachnoid hemorrhage. And so the idea that you're able to capture not only the pain quality, but also the pain severity is something that we can do with emoji potentially in a much better and more universal way, especially if you do not speak English, because everyone in the world will have access to these tools. Basically, and also it's something we can potentially do in the future is ask patients, what about Fitzpatrick modifiers? Does that modify how you answer some of these questions, right? These Fitzpatrick modifiers actually are existing in most devices for emoji today. And so these are fundamentally very, very important questions and very interesting questions that we want to be able to answer. So then you can also imagine things like chest pain and specifically for specific descriptors, like elephants sitting on my chest or my chest is on fire. So we want to eventually then even be able to question, can we then integrate them into things like discharge notes? And then we're also doing this huge project basically creating this thing called Dr. Lingo, and this is a very quick plug, where we are basically translating this jargony language into English non-jargony language. And if you can do that, you can also then translate that jargony language into visual analog language as well. So that's the work that we're underway right now into understanding better this very fundamental thing called understanding patients in a very more objective way. So we are doing a lot of work in this. The highest priorities are pediatric free inputs, especially in children. And so we are looking for collaborators in children, and also especially in child psychiatry. How do child psychiatry patients actually interpret and express their feelings of symptoms? This is a very interesting question that could potentially be addressed using free descriptors of emoji. We haven't quite started this part of the project yet, and we certainly are looking for collaborators. But let's talk about the data we have already. And this is very exciting. So in the ICU, actually in the ED and on the floors of Mass General Hospital today, we are asking patients how they feel with these things called emoji-based visual analog scales. We are going up to patients and randomizing them and ask them 2 questions. 1, how is your pain today? And then using a emoji scale, and then asking the same question in a numerical rating scale and asking them, does it equal each other, right? We just want to be very clear. So this is IRB approved. And these are the 2 scales that we're starting with today. One is the emoji and one is the numerical rating scale. So preliminary data today is that we have 103 patients surveyed. About 83% are Caucasian and 46% are female. We are asking across all types of pain, whether it's abdominal pain, chest pain, back pain, extremity pain, laceration pain, headache pain. And basically that there's almost perfect agreement. That's the key result with emoji scales and this numerical rating scale. Keep in mind, again, this numerical rating scale is used every single day by nursing to ask them how they feel, especially after something like a major surgery or a large wound or complication of a wound. This kind of pain can be a very important signal for complications, for things like recovery, for discharge from the ICU. And so we are finding that emoji scales can be just as good a representation as every other this numerical scale that we ask currently in the entire hospital every single day. And so this is kind of that preliminary data. And then this is the kind of that agreement that we're showing that basically there's almost perfect substantial agreement between this numerical rating scale and emoji-based scales. And the next approach after that is going to be to start to do kind of the more complex equivalency studies with emoji-based scales, with Wong-Baker scales, with verbal rating scales. We do a lot of randomization between these very complicated scales so that we can have a very clear order between them. And then we're going to just basically try to show and see if this emoji-based approach is one that can be equivalent to what we are doing in the hospital every single day, thousands of, across the country, probably millions of times a day, to ask every patient how they feel. And so if we could show this in emoji, we can then start to do things like build them into the EMRs, because again, they are already in the EMRs as Unicode. We can build them into digital health applications so we can have high fidelity data. And so that's going to allow us to basically start to validate and create a whole new section of something called patient-reported outcomes and to really drive the science forward. Questions on that? All right, so I'm going to give a little bit more time with this last part of the talk, which is basically, what is it we're trying to do here exactly, right? Especially with emoji, and why is this important? And I would actually propose to you that today with emoji, this would actually help to solve and help not purely solve, but help some of the most persistent problems we have in medicine today. And I would propose that actually a lot of these issues are communication problems, especially in diagnostics today. So this is the Digital Health Center, and I want to talk about a little bit about digital medicine, digital information, and why this is so important. So I would propose to you that emoji actually is a really fundamental approach to what digital medicine is, because digital is a lot about communication. Here's a really interesting piece of history. In the 1940s, when basically during World War II, there was a lot of work around code and code breaking and communication from one troop to another. And the predominant thinking at the time was that there was no possible way you would ever have very high fidelity data, because it turns out that and the thinking at the time was that when you would transmit more and more signal, you would inevitably have more and more noise, right? Because more errors would compile over time. We know that's not true because I am talking to you on Zoom today, and to say the words I am saying are clearly communicating and translating, right? Because that is basically what happened with something called the information age. There was a guy named Claude Shannon, and he invented something called information theory. And what he basically created, and I don't think he didn't really realize at the time, was that this was the fundamental mathematical basis for what allowed CD-ROMs and satellites and basically the entire modern era to be created, because he basically created this thing called entropy. Now, I get in trouble whenever I introduce any sort of algorithms whatsoever into any slides, so I will not go into the math, but I will try to convince you that basically this was the future, was that these algorithms would allow you to basically transmit information across thousands of miles, space and time. And this is why CD-ROMs could play music despite having scratches in it, because you would have these algorithms that would basically be able to infer information from the CD-ROM into the meaning that you're trying to infer, which was a song, right? And so what I'm trying to explain today is that when we see patients in the ER, for example, we are trying to infer meaning, which is, what is your disease, right? And we are trying to ask them with our tools like verbal communication, like written communication, and now with an additional tool like visual communication, that we are trying to understand fundamentally what they mean, right? And that helps. And actually, this is the applications of this is basically in every single field of medicine, actually field of science to this day. You can actually, with his algorithms, look at a black hole and figure out exactly how many gigabytes of information there is, which is really amazing. And so we're trying to do the same thing with human beings. So this is a general communication system that was in his paper. I know this is really off. I swear this has a linkage to emoji, because let me tell you this, and we'll get to this part. Emergency medicine is this game of incomplete information. When a patient comes in the ER, we're trying to figure out, what do you have, right? And you have something called chest pain, or you have something called abdominal pain, but we want to be able to figure out what they mean. And so when we are asking a patient how they feel, we are trying to interpret that fundamental meaning. And so what I want to ask you is this: when you see this emoji, how do you describe this emoji in a verbal method, right? And I would propose to you that there isn't a very good way to describe that in a verbal communication method, right? And so what's happening with emoji, what's so really interesting theoretically about this is that it's actually starting to give us information about patients in a way that we can't actually interpret and actually communicate in a way that is verbal. And so things like dizziness is persistently one of the biggest issues in medicine today, because when someone says dizziness, it's very, very hard to interpret what they mean. And so when we are able to create more tools to understand what patients mean when they say the word dizziness, right, we are then able to better interpret and to better do diagnostics to find things like stroke, or things like musculoskeletal weakness, or things like vision changes that lead to dizziness and headache and those kind of problems today. So that underlies a lot of the theoretical basis for why we're doing this, right? Because it really can help people if we're able to better communicate and to better have that ability to understand the meaning of what someone is trying to tell us. And ultimately, fundamentally, it may be through emoji, but also it may also be through other visual skills that are digital. And that is why this work, and for example, here at the Digital Health Center is so important, and why actually this fits into a part of that. So thank you for your time and effort and energy and listening to this talk. And I'll stop there for any kind of questions and anything else you might have.
Thank you, Shu, for that excellent, informative, and thought-provoking talk. I am going to open it up to the larger community for questions or comments. I know a number of you have work in parallel areas, so I encourage you to raise your hands or to type things into the chat if you're not in a space where you're able to talk out loud. Lex. And I'm going to ask you kind of when I call on you to please introduce yourself, kind of who you are, where you are, just to give Shu a sense of who's asking the question.
Sure thing. So first of all, thank you so much. That was a wonderful talk. This is an area that I have been, oh, I'm sorry. My name is Lex Hurley. I'm a fourth year PhD student at the University of North Carolina at Chapel Hill. Right now, I primarily work with digital behavioral change interventions, usually in the areas of weight management, physical activity promotion, diabetes management, and such. This is something that I have been fighting with my advisor on for a little bit because we have been using just-in-time adaptive interventions, JIDIs. And I have been wondering about the efficacy of having a little 5-item emoji scale in response to messages in order as a way for us to track if different types of messages focusing on various BCTs will be more or less efficacious for participants. But to your very last point, that it has been difficult to exactly describe verbally some of these emojis. This has been, I do agree with your point that it's a new interesting field and how we can communicate with one another digitally. However, it leads to a lack of systemization and reproducibility, which is something that is of concern whenever I'm trying to bring this into the behavior change field. I was wondering if you had any comments on this.
Yeah, this is a really interesting problem. And this is actually, I actually had someone ask me that question, and I would actually propose to you, it's not a technology problem, it's a scientific one, right? And I actually would fundamentally say that language is like that. As in, language fundamentally always evolves, right? I always say, what is the right way to say Los Angeles? Well, we say Los Angeles, other people say Los Angeles, and there's multiple ways to say a word. And it really tries to interpret the same meaning, which is this city on the West Coast, right? So I think fundamentally, there's never going to be one solid basis for meaning, and it will be a cone of interpretation, right? And so that's why I think that it'll, we actually were talking to collaborators that had a very large Nepalese population, and the science behind applying the same emoji scale to that population would absolutely tell us new information, because there's going to be dialects of emoji and how they interpret these words. So we know that, for example, in different parts of the world, different emoji are used in different ways. And so this is going to be something that is not universal and not completely standardized, but I would propose to you that that should not be the goal, because information and language is never static, right? It will always consistently evolve, and that evolution, we'll just have to continue to keep up with it. But the ability to consistently on mass scale measure millions of emoji consistently over time and have regional variations and be able to help interpret that, I think that's going to be something that's really important over time. And basically, my answer is, because we're going to be using digital tools, we'll have the ability to look at mass data, and then we'll have to basically do that work after that. There's not going to be an easy way to do this. But I would say Unicode does track usage of emoji and its regional variations. And that's something that's going to be a consistent problem over time that we'll have to not only think of as a problem, but also as an opportunity.
Thank you.
Thank you. Tally.
Yeah, hi. I am Tali. I'm a third-year PhD student at Brown. I'm actually on the computer science side, and my research is around online communication, particularly private communication, and building social support networks. We actually work a lot with emojis. We're doing something with like emotional disclosure online using emojis. Yeah, I guess I have maybe more of a technical question to kind of bring them what you were just saying about like different areas have different dialects, and like, similar or the same emojis can be used in really different ways depending on culture, depending on platform. And kind of, you touched on this briefly, I think, in that you were saying like, how an emoji is displayed on, for example, an Apple screen versus on Android is going to be really different, or can be really different. And I guess I just wanted to hear maybe a little bit more on your take on like, you could say, okay, for example, the grass emoji in some countries can be used as like LOL or whatever, but at the same time, that same emoji that somebody in the same country, in the same state sends to like their friend, like let's say the slightly smiling emoji on an Apple phone or an iPhone might look like sarcastic versus on an Android phone, just because like the graphic is slightly different doesn't give that impression. So like, how do you handle those discrepancies, and like, what are your thoughts?
So I think the application of what we're doing in patient-reported outcomes actually really matters here. So if some of the modern tools for patient-reported outcomes are going to be very internally consistent. So for example, when you ask a patient how you feel with your depression today, right? It's going to be some measure of level. Let's say, the tool is a 1 through 10 scale on an app, and I put 5. And then after my treatment, after my therapy, and after seeing my family, it goes up to 6 and 7, right? And then I have some stressful event, it goes down to 2 or 3. So a 2 or 3 is not going to be universal to every single person with depression, right? Because there's going to be regional variations of how you interpret a number, but it's going to be very internally consistent to me, right? And then you're going to have basically that large data set over time. And then because we have that data set, we're going to be able to interpret that individually to me as a person, right? So I suspect that emoji is going to be very similar, where it's going to be very internally consistent, as in I use a certain emoji in a very internally consistent way, and that will tell you a band of information, but it will not be externally applicable to the worldwide population because we're all different people, right? But that's why I think this sort of individualization of these applications is going to be so important to then basically take this large amount of data set and say, hey, listen, my baseline is this emoji, right? But my delta now is this, and that actually is conferring the issue, right? And so I think that will probably be the answer. What that looks like from a technological standpoint and from a CS perspective, I think is mostly a data science problem, right? Of measuring like when you have a delta from a baseline, and then giving basically a signal to say there is an action item now to be had if there is some sort of delta from a baseline, right? But I do not think, unfortunately, I don't think it's, as you point out, will there ever be a universal way to communicate with one emoji? I don't really think so, right?
Thank you. And thanks for the great question, Tali. In King, and I apologize if I didn't say your name right.
Yeah, that was close enough. Hi, I'm a second year PhD student at UC Irvine. So broadly speaking, I'm a health informatics, human-computer interaction researcher. And first of all, thank you for the great talk. It was very insightful. So I've been collaborating with psychiatrists on a project to explore how to support discontinuation of antidepressants. And like the current project that we are exploring is like, so psychiatrists prefer to use standardized clinical questionnaires, but that might not reflect patients' individual experiences that they want to convey to their providers. So we are thinking about adding annotations, and like we are considering emojis as a very important way of adding, helping patients to convey their individual experiences. And one challenge that, so I guess my question is like, do you see using emojis for monitoring patient symptoms between visits as well? In addition to checking how they've been like during the visits? If so, how do you see, how should we summarize the data? Like if there are like hundreds of data entries, would the fact that the emojis are Unicode be helpful for summarizing the data to enable effective communication between patient and provider?
So this is a really interesting question of like what it means to be valid, right? I have to say that like science is a human endeavor, and we should never forget that. And that when we prove something is true, it still has an interpretation, right? So there's always this famous thing of where when a patient has a heart attack, and we basically have a full blockage of one of the coronary arteries, we know that the science is very clear that you should put a stent into their heart, right? That was very proven evidence. Over time, it got interpreted differently, as in, you wouldn't necessarily have to have a full blockage of your heart. You could have partial blockage of your heart and small blockages of your heart, right? And then we took that same data and said, well, let's continue to do that thing that we did for the full blockage, which is clean out and put a little stent in, right? I suspect it will be very similar. And that's why the science will be around very key papers that can then create inferences for other applications, right? It's impossible to apply science to every single population. The science of, like, let's say we prove out the emojis are useful for depression. For every single patient with depression across every single language and cultural barrier, right? But we will know that it is a valid tool to use, right? That when I say to somebody in medicine, let's use the emoji scale, they're not like, what? Wait, what? This is a joke, right? That is valid. And then we can then create inferences to say, well, if the smiley face, a happy smiley face is valid for this population, it probably might be valid for this population too. And we're not going to be able to prove for every single subpopulation, right? But we can then create inferences that give us meaning and then give us the action items that we can then all generally agree and say, that's okay to use, right? So I guess to your question, in psychiatry, one, there's going to be so many different ways to express, right? So I think the first initial methods is going to be a panel. So a smiley face panel, right? And then you apply it for a specific population, which is depression. And then over time, I think it'll start to just evolve because it's a science of human endeavor to more and more free emoji panels and text that can then be interpreted in different ways. And I think, unfortunately, that's going to be the answer. It's not the most scientific answer in the world, right? But it is, I think, ultimately, fundamentally a human endeavor. And I think that's the way that it's going to probably evolve as a usage over time.
All right. Thank you. Thank you for your answer.
I appreciate that, Shu. And I'll just kind of highlight as one example, there's this little sparkle emoji, right? Which started as this like happy or sparkly thing that now I hear from my 13-year-old teenager is now being used sarcastically or to actually indicate frustration or annoyance. So it started as a happy, right? So things just shift over time, the same way that slang does. So there are a bunch of terrific questions in the chat. We only have about 5 minutes left. I am going to try to summarize them all together. There are two. One is from Brittany Johnson, who's a postbac research assistant, and then from Allison Seeley, who's our education coordinator, asking about kind of how you'll handle the fact that some medical emoji are not immediately recognizable by a portion of the population. And how, if you could clarify your vision then for the application of particularly the internal organ emojis, given that first of all, they might not be recognized, and second of all, they don't necessarily correlate with patient presentations. So that's a first question. And then the second one comes from Charles Lee Joseph, a Brown alum, asking about whether or how emoji are being used in obtaining patient satisfaction data. To Charles Lee, I'll actually answer that. I'll send you to some of the work that Anish Agarwal is doing at Penn. He's done some nice things with having the, were you gonna say that, Shu?
Yeah,
so,
exactly.
So he does, like, he has a thing like the restroom satisfaction things, but he's used it actually in the ED. And so I would tell you to look for his work. So Shu, I'll let you answer the second questions about like how you're handling that recognition and kind of what your vision is of the internal organ emojis going forwards.
So just given time, I have a whole shtick about this whole recognition thing, but I'll kind of be brief about it. Is that in the Chinese language, if the word for Xin, which is heart, doesn't exist, do people recognize what Xin is, which is heart? You know what I mean? So right now, the language is like emoji are thought of as an annotation almost, but I would propose that it's much more like a language like Chinese, in the sense of it is fundamentally a language that people are using to communicate with each other. And you don't always need verbal communication to talk to each other, right? If you're angry at someone, you can put an angry emoji. If you're happy with someone, you can put a happy emoji. If with my fiance, I use the anatomical heart emoji because that is what conveys meaning. And so if you don't have the tools in that language to communicate, you can't understand that word, right? So for things like, what would you propose to do with the stomach emoji? Or what if people don't recognize it? Well, I would actually propose it's the other way around. people won't recognize a stomach emoji if the stomach emoji doesn't exist. And so that actually is what helps the medical education and the health of populations. If you can understand that there is a liver emoji, right? The argument against the liver emoji existing is that people don't know what the liver looks like. Well, people don't know what liver looks like because there is a liver emoji, right? So I would make that the argument for why that organ should exist, because it is so fundamental. Everyone has a liver almost, I think, right? So it's one of the most universal things that there are, but they may not know what it looks like. But there are a brain and a heart and lung, because I think the general population believes that those things are very accessible and very part of who we are. But I would argue the liver is just as important as your heart and lung, right? To basically living. And so we should be aware of it. We should take care of it, and becomes part of our language. In terms of the real quick, briefly for these other emoji as well. So there is this very common argument, and this goes back and forth at Unicode, is that should emoji purely be based on frequency of usage, or should it be based on importance of usage, right? So there was a paper in Resuscitation in, I think, 2019 that basically showed that if you had emoji-based instructions for how to use AICD devices, that people would be able to use AICD devices probably a little bit better. And so would it be as frequently used as, for example, the upside down happy face emoji? Probably not. But is it probably in that moment one of the most important emoji that you could ever imagine for your livelihood? Yes, right? So that there is that question of these less frequently used emoji, how important they could be in a very situational basis. And so I would argue that that's why some of these more medical emojis should exist. Because honestly, I don't know what people could do with it. I just want to be able to give people the toolbox and the language to then apply it for potentially very important situations, even if they are not as frequently used.
Thank you, Shu. I know that we're coming up to the top of the hour, and I love to give people a chance to stretch their legs or get a glass of water before they head to their next online only program. I'm going to call your attention to please fill out the survey that Allison put into the chat. This is how we improve our seminars and also provide feedback to our speakers, which helps them with their own careers. And I will also invite you to consider registering for next week's seminar with Project Sunshine, which is a really cool nonprofit on their digital tool Teleplay for providing digital child life support. They're a project that's affiliated with Brown and does really cool work, and they're really excited about our input and feedback. And I think there's a lot to learn from what they've done. The last thing that I'll say to the group is to keep your eyes open. Do sign up for the listserv if you haven't already, because we have a very exciting announcement coming out in just a couple of days that Allison will be sending out around pitch nights that we'll be having available. So sign up for the listserv if you haven't already. Shu, thank you. It was such a delight to get to see you, albeit remotely. Thank you for joining us. Thank you to all of you for your thoughtful questions and participation. And I look forward to seeing you all soon. Thank you.
Thank you.